segment is sponsored by Intermountain Healthcare.
Today we're asking the experts about breast cancer since October is Breast Cancer Awareness Month.
So this is McCall Larson, genetics counselor at Intermountain Cancer Centers. We appreciate you being here. Thank you.
Thank you so much for having me.
Yeah, thank you. Okay, so McCall, how common is hereditary breast cancer?
Hereditary breast cancer is very common. So in general, 1 in 8 women do develop breast cancer. Out of those women, 5 to 10% have a hereditary form of breast cancer. So it is very common.
So I guess the next question would be is how do we know if, how do you determine if you're a candidate or not a candidate, but at risk for hereditary breast cancer?
Absolutely. That's a great question. There are 3 signs that you can look for in your family history. The first sign, if you have 2 or more of breast or ovarian, pancreatic, or colon cancers in your family. The second sign is if you have any cancer diagnosed under the age of 50. And then that third sign is any rare cancer, such as male breast cancer. Any of those signs in your family, that's possibly hereditary cancer.
Okay, so what should we do if we are at risk for that?
So if you are at risk, definitely come and see a genetic counselor. They're all at the Intermountain hospitals. A genetic counselor is a healthcare professional who analyzes family histories to know if genetics can be playing a role in that development of cancer.
Okay. Wow. How do you know, how do we contact an expert to deal with this kind of a thing?
So talking to your primary care physician or calling any Intermountain hospital and asking for a genetic counselor is the way to get a hold of any of us, getting a referral over to us. Okay?
It's a scary, scary
I know,
thing.
It is scary.
Yeah,
My wife, they noticed a lump or a mass is what they said, and so they, everything that we thought was okay, and then they called us back and they said, we need to do some more testing and some more ultrasounds and stuff. And I'm telling you, that was a scary, scary time,
That is very
yeah,
scary.
and I feel like people now should be getting mammograms younger and younger. What age do you suggest for that?
Well, the age for everyone is age 40, and if you have any family histories of breast cancer, starting that 10 years before the earliest diagnosis in your family is the best way to catch that early.
Wow, so if you do have that in your family, then you probably should go a little bit earlier.
Yes.
Okay,
Absolutely.
and we have Ask the Expert standing by all day long, so you can call right now at 877-908-0680, and you can also reach out to them on social media by using the hashtag #AskTheExpert. And McCall, what would you say as advice to somebody who's sitting at home thinking about it? Would you say just go in and get it done, don't be scared?
Yes, absolutely. If it's something that's on your mind, please call us and come in and talk to us.
Yeah.
And especially if it doesn't necessarily have to fall in the hereditary part of it too, even if they have one level of hereditary breast cancer,
Yeah, might as well.
Wow.
Okay,
Yes.
McCall, thank you so much. We appreciate it.
Thank you for having me.
With the invention of virtual reality, it seems like